For many families, the transition to middle and high school can be an anxious time. The small local elementary school gives way to a larger environment with more kids, multiple teachers, and less school contact.
One of my main concerns when we started middle school was the fact that we had an amazing experience in elementary school. Awesome nurses who knew about CF, they knew our deal, so going into a new school, not knowing anybody really, was a little scary.
For parents who are enrolling their child that has CF in a school, it is very important that you share anything and everything you can with at least one staff member. Usually it's the nurse or the school counselor that gets the information and disseminates it to everybody else.
I met with the team at our middle school before he left elementary school. So we were able to kind of create a plan, know that there weren't any other CF kids in his class, how he was going to carry his enzymes or if he had to go to the nurse's office, that kind of stuff we were able to address before he left elementary school.
Some teachers will have more questions, so sometimes it's good for either the student or the parents to talk to the team of teachers, even just to touch base and say, do you have any questions? Do you understand? Because some teachers might be nervous about that if they don't know much about it. So I always think it's a good idea for the parents to maybe call a meeting or explain, just so the teachers feel more comfortable in knowing what their role is and what's going on with the kid.
One question many families have is about managing enzymes and other CF treatments while at school.
The older students are self-managing their symptoms and self-managing their medications in often remarkable ways and have much less contact generally with the school nurse than the younger students. I think the only issues for them, of course, has to do with the pressure to be in school, the pressure to maintain their grades is a bit more than in the younger students. And so if they're feeling that anxiety, that's a trigger point for help from the nurse, help from the social worker, help from a Section 504 accommodation plan.
My name is Abby Snyder. I am the hospital-based teacher at the Barbara Bush Children's Hospital at Maine Medical Center in Portland. Part of my job is to establish a relationship with the patient and the family. So what I usually do is I meet the patient and get the consent of the patient's parents to contact the school. And of course, each situation is very different. Some patients come in for a short amount of time, some for a longer period. But during the process, I collaborate with the sending teacher and work to get authentic classwork into the hospital. And the students usually, in most circumstances, come into my small classroom and we do work that they're expected to be doing while they're out of school. So part of my job is to advocate for the patient and communicate with the teacher. When I meet parents of children with cystic fibrosis, they indeed do share information about their child's school situation. I have been able to obtain resources about cystic fibrosis from the families and from local resources at the hospital. Every situation is different. I do work with teachers all over the state, and some are rural districts, some are urban districts. For the most part, so far anyways, my interaction with teachers has been nothing but supportive. It seems as though the sending teachers really have a good sense of their students and their abilities and the limitations.
When I first learned I was going to have a student with cystic fibrosis, the nurses at school, the care team told us, they gave us information about every student with medical issues. I was familiar with cystic fibrosis. However, being a chronic disease, I was unsure of what my part on a daily basis would be for the student.
My biggest concern when Gavin was transitioning into middle school really revolved more around the time that he needed to do treatments and the time that he needed to put into sports and athletics and everything that he needed to do also for the load that he had at school. I think when he gets into high school, it'll be even a bigger deal.
When people see me take my pills at school, they get curious sometimes, so they just ask, like, what is that for? And I've even had some people say, I've had that before. I'm like, I don't think you have. But they just ask, what is that for? And I say, I have a genetic disease, and It's called CF. It's a lung disease, so I have to take that for my digestive system.
The main concerns for children entering middle and high school is fostering their sense of identity. Children in this age group are really questioning who they are, where they're going, what they're going to be in this world. And with fostering that identity, they can appear egocentric or selfish, but really they're just taking those steps to figure out where they're going and building their peer relationships and really figuring out what they're going to be when they grow up. Some suggestions for families to encourage coping during this transition are to really keep the lines of communication open. Encourage your child to talk to you and ask any questions that they have. Make sure you know who they're hanging out with and what they're doing in their spare time. You want to foster their need for privacy and independence, but you also have to remember that as the parent, they still look to you for structure and guidance.
Another thing that we did that I think helped us to transition to high school, because at each grade you're moving to having more and more teachers each year, and it's less likely that may never see them other than an open house. So we prepared sort of a one-page cheat sheet, a Xerox paper that I had typed up, and it's a summary with bullets of the things that are in the booklet about CF, because I know teachers have so much on them that it's hard for them to even read. Obviously you can't almost expect them to read through a booklet. So we would do this one-page sheet with bullet points, and I emphasized the things that were more likely to be going on with Mary Alice, because different CF kids often have certain symptoms. So we would do that, and I had her picture on it so they could relate her face to what was on there, and I found that very helpful, and the teachers really seemed to like that.
I guess the advice that I would give to people who are moving their children toward those middle school years would be, as difficult as it is, preparing them for adulthood. I think CF parents have to look at the disease from so many different angles, and we have to be on top of so many different things. It's not just their lungs, it's every aspect of their health. And letting go of some of that control, I think, is going to be a really, really long process. And, to me, I feel like the sooner you start it, the higher level of success they'll have once they do go off to college or wherever they're going off to, their own lives.
I think an additional concern for families with children who have CF is the adherence and compliance to treatments. Most of our teenagers do show signs of poor self-management, and although that's considered developmentally appropriate, it's no easier on the family to handle these concerns. Working with your care team and making a plan together with your care team and child really can go a long way.
To learn more about this issue, ask your CF Foundation accredited care center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.